So in this video, I'm going to talk to you a little bit about acute back pain. So I know there's a few videos that are on this channel that are about acute back pain, but sometimes we just can't get up. This is for when you have kind of sneezed or coughed and you felt something go, or you've bent down to pick up something light like your slippers and you've just felt like you've gotten stuck and that you've flexed forward like that and it's almost impossible to stand back up. And this can be very stressful and very scary, and we've heard all those things about everyone who's like slipped a disc or got a pinched nerve, and I'm here to tell you that it's not all doom and gloom and it can settle if you do the right thing. So I'm going to talk to you now about McKenzie exercises, and Robert McKenzie devised these exercises to try and get whatever's getting caught out of the way. So you're going to do a few positions, and in each position you're going to wait for the pain to settle and maybe wait for that pain in the leg to calm down. And what happens is that leg pain will calm down by retracting back towards the spine. So if you feel like it's getting worse or it's going down into your foot, you should stop the exercise. But if you feel like it's getting better or it's settling down, then you carry on. These exercises can be done like every 3 hours. If you are feeling that pain starting to regress and track down your leg again, then you would try some of them to try and calm them down. So we're going to go through a few of these, and you can see how you get on. You can try these when you have that acute back pain that you can't stand up. Like our instinct is that we want to stand, but that sharp stabbing just doesn't let us. And it's almost impossible to do it while you're standing. So this, when you're lying down, takes the pressure off the muscles, and it really helps to just settle down that kind of catch that you've felt in your back. So I'm going to go through them now. Let's see how you go. So the first thing you're going to do is when you have that acute back pain and you're stuck in the forward flex position, is that you're going to try and crawl onto your bed from the bottom up. And then you're going to pile all these pillows underneath your tummy to try and keep you in that forward flex position. Lower yourself down and lie face down. In this position, you're still stuck in that forward flex position, and you should wait now in this position. You can probably be here for up to 15 minutes, waiting for that pain to retract up your leg and until you feel a bit better. Once you start to feel a little bit better and that back pain is settling down and the pain down your leg is coming back up towards your hip or towards your lower back, you can take some pillows out. So you're slowly but surely starting to flatten out. So even as you get better, you would take pillows out until you're completely flat, and you lie in this position until the pain settles down. You don't need to rush it. It can take up to an hour, so just relax. As you start to feel better, you can raise yourself up onto your elbows and stay in there either for a few seconds, or if it feels better, you can do repeated up and down. So you would come up to here, maybe count to 10, and then settle down again. And keep going until your back feels better and until that leg pain settles down. Sometimes you may not be able to come up all the way, but you just go to where you can. If it's not today, then try again tomorrow. As you get better, you're going to start really raising yourself up. If you can't get there, don't worry, just take your time. And also try to make sure that your hips and your glutes and your back stay relaxed. It must all be in your arms. And as you get better, you can start to raise yourself up onto your hands. And then you would go down again. And then up. And down. And you would do that in repeated motions until you feel better. Then once you are feeling better, you're going to stay in that extended position. So you would walk yourself off the edge and stay in the extension and lift yourself up, and you're on your way. So now that you are up, you can try and maintain that lumbar extension by putting your hands on your hips and doing a few backward bends in standing. This you can do every hour on the hour if you're sitting at the desk, and don't forget to maintain this lumbar extension by using a rolled up towel or a pillow in your lower back while you're sitting at the office or while you're driving your car. So I hope these really help. You can try these sets of exercises every 2 or 3 hours if you're at home and that pain is really acute, to try and settle it down, and then you can get used to doing the standing ones every hour on the hour, about 10 times or so, to try and settle it down. I really hope this helps your acute back pain, and please give us a shout if you need some more advice.